Grand Rising, Houston, downtown, midtown, third ward, fifth ward. Those of you listening in the car at 102.5 FM, Grand Rising to you that are tapped in through our free KMAZ app, and Grand Rising to you listening on our website at www.amazing1025fm.org. I'm Amanda Sapp here on the Amanda Sapp Morning Show on Amazing 102.5 FM. Your do good through good station where we're changing lives one listener at a time. We've got another segment of Mission Possible where we're bringing executive leaders into our studio to share with us the challenges that their organization has encountered internally and externally, and also how they've overcome them and what it is that their organization is doing to impact community well. There are two guests that I have here in the studio with me that I cannot wait to share with you. But first, I want to share with you about the organization that we're going to be talking about. Is that okay? All right. This particular clinic offers comprehensive care across 50 plus locations in the Texas Gulf Coast, serving all patients regardless of ability to pay. As Texas's largest FQHC, Legacy provides a full range of services with a sliding fee scale to support underserved communities. And the guests that I have here to represent this organization, I'll share with you a little bit about who they are. She is a licensed professional counselor passionate about supporting clients' healing with degrees from UNT, Midwestern State, and Sam Houston State. She's a proud wife, mom, Alpha Kappa Alpha member, and lover of roller skating and ice cream. She would consider herself resilient, ambitious, and optimistic. Please welcome the Director of School-Based Therapy at Legacy Community Health, Antoinette Wilson. Grand Rising.
Thank you so much for that warm and lovely introduction. Thank you.
You're more than welcome. You didn't come alone. There is a wonderful woman next to you. I'm going to share a little bit about who she is. She is the Senior Director of Public Affairs at Legacy Community Health and is a former journalist who has championed public service work for over 20 years. In 2024, she secured over 600 media mentions and major earned media value for Houston's third largest nonprofit. She holds degrees from Columbia University and Wesley College. She would consider herself determined, empathetic, and creative. Please welcome into our amazing studio, Carla Newman. Grand Rising.
Thank you. It is such an honor to be here.
I'm glad to have the both of you here, and for good reason. We're talking about the impact that Legacy Community Health offers in the community of Houston, Texas. And we will start with you, Carla, in sharing us why it's important for you to have Antoinette Wilson here sharing all this great information about what is happening at the mental health capacity at Legacy Clinic.
Well, I think it's a story that's so important to Legacy's community. That's our mission, is to connect our communities to care every day in every way, and behavioral health is a huge part of that. And as we know, there's a mental health crisis in our city and in our country and in our schools. Mm-hmm. And so Antoinette is superbly well qualified to talk about some of these stories, the impact we're having in the dozens of school-based health clinics that we serve in KIP and Yes Prep and Galena Park ISD school systems, and really it's a huge benefit to those communities is to have kids who have access to behavioral health right in their school walls, where their mom or their dad doesn't need to take them out of school and take them and get them the support that they need. And it's also a huge benefit to the administrators and the school counselors who are often overworked and just can't keep up with demand. So Antoinette is best suited to tell that story.
Well, dang on, Antoinette, we gotta find out more. Thank you, Carla, for that information and sharing with us why you today. Antoinette, tell us a little bit about who you are or how long you've been at Legacy Clinic and why this discussion matters to you.
I've been with Legacy Community Health for almost 12 years. Mm-hmm. And there is something so beautiful that I have been a part of. That is the work that we're doing within the school-based health program. I would like to consider Legacy School-Based Health Program as this sweet gem of Legacy. Every day I go into work, and although I'm walking the hallways of a school, I get to be a part of the eyes, the ears, the heart of the school. I get to be a part of students and community every single day. Can you imagine as a mom, and I know when I came in I told you I'm a tired mom, can you just imagine if you sent your child to school and they were able to receive behavioral health services, that they had someone to talk to about matters of the heart, matters of the mind, that they had someone who could follow them over the course of their lifespan, throughout the years, and watch them grow and have a safe space to talk about everything that's a part of their world. Today's children have so many different things that they are dealing with, that they're struggling with, things that they often do not tell their parents, things that they wrestle with inside, things that might be quite scary to share with their mom, with their dad, with their abuela, with their aunt. And so legacy allows us to be in a school setting and allows us the great honor and privilege of providing therapy services. That is such an honor. It is such an honor to be able to walk with the child, talk with the child, help them develop better coping skills and allow them to express themselves in a way that perhaps they don't even express with their family or with their friends. And so we have this partnership within the school where we provide that service. And legacy is not just about therapy within the schools. We also have psychiatry. And so if children need medication, they have access to that. If children need other services such as vaccines, immunizations, they have access to that. And mom does not have to leave work. Her child is taken care of within the school day. So when the bell rings, they're able to go home, get on the bus. But all of these services are wrapped within their school day. And I just think that's really special.
And it's very special. I have a couple of questions that are just swimming through my head. The first one is, how does a school get to have Legacy Community Health at their location? And then how do you get kids to feel comfortable enough to share with you how they're feeling at the moment?
We are so fortunate to be a part of 3 different districts: KIPP school districts, Galena Park school districts, and Yes Prep school districts. And so we have a partnership where we work hand in hand with the counselors at each of those school districts, and they help to log students in virtually for appointments and in person. And then we also hire providers who are passionate about serving within the school setting. And so these providers make sure that those students are seen. They make sure that they're taken care of. And so I think it takes a certain type of special person to work within a school setting. Someone who is connected to children, maybe they're a parent, and that's their connection to being within the school. But to me, I also see it as a ministry where you get to serve every single day. And so when I think about the type of people that walk those hallways, that are in that cafeteria, that are going from class to class to meet that need, that is someone who has a servant's heart. And that, to me, those are the type of people who work for Legacy within our school-based health program.
Are you guys looking for more therapists or psychiatrists at any of the school-based learning? What is it? School-based learning. You said it earlier.
School-based clinics?
School-based health clinics, yes.
Yes.
Are you still looking for more therapists?
Absolutely. We have different school sites from the north side to 3rd Ward to the south side as well. And we have over 37 different school clinics. We have over 40 providers at each of those sites, and that includes medical, behavioral health, and psychiatry.
This is really good. And I have to wonder, do the parents know that these services are available to them, and do they have to pay for it?
These services
at the school, I mean, if they're
Legacy does not turn anyone away because of their inability to pay. The awesome thing about Legacy is that we have the ability to work with patients who may need to see a provider on a sliding scale, and no one is turned away. We accept CHIP, we accept Medicaid, and so there are all these different ways that patients can be seen. And I think the biggest goal of Legacy and our purpose, and it's connected to our mission, is that we eliminate barriers to care. So if finances are a barrier to care, that's not going to pose a threat to that patient receiving services.
We talked earlier a little bit about representation and if people are comfortable with if they see who they are. I don't know if I'm saying that in a way that makes sense, but if you can see someone that looks like you, maybe that may help provide a sense of calm and belonging, that you're talking to the right person. And Carla, you mentioned a little bit about the population of African American and other minorities that actually are therapists within the school-based health program. Can you share a little bit about that and how you all have made representation a very big part, or that it matters within your organization?
Sure. Well, for instance, in a school district, say like Galena Park ISD, we're very mindful that we need to provide providers who are bilingual and who can serve Hispanic or Spanish-speaking children in their own language and who come from their culture. And so that's just one example. Or in Third Ward or Fifth Ward, where we have clinics, we make sure that ideally that many of our providers come from those communities and they understand the circumstances that those children are living in. And it gives them a special empathy and connection. And kids get when someone gets them, right? And so they're very smart. And so we really are very mindful and thoughtful when we're hiring that our clinicians, such as Antoinette, that they really get the community that they're serving. And as she said, have a servant's heart. And that's not always easy to find, but it's been crucial to our success.
Can you share with us, thank you, Carla, and Antoinette, can you share with us any success stories of a young person that has connected with a therapist at the school-based health program, and maybe they flourished, maybe they were able to go to their next step, whatever that is? Can you share a success story with us?
Right now, I'm thinking of quite a few different kiddos throughout the course of the pandemic. I remember that day, that week actually, so clearly. It was March of 2020. The rodeo was in town. And I remember during the pandemic hearing teachers outside of my office talk about how the rodeo was going to close and that we might be out of school for some time. But I never would have thought that our lives would have changed so drastically, so quickly, and so significantly. And I remember how I said goodbye to my students, not knowing that it would be maybe the last time that I would see some again, or that we'd have to transition to a completely different way of living that we've never done before. And that was welcoming this virtual world that was so unfamiliar at that time. And I'm thinking of quite a few different students in this moment who they left school in person, went home virtually, but they walked across the stage and they graduated. And I held their hand during this process of therapy during an entire pandemic that we didn't expect to see happen. To me, that's a success story, that you can be a part of someone's life and you can encourage them to still meet their goals, that you can encourage them to still pivot, even though life didn't work out the way that they thought it was going to work out, and things didn't happen as they intended to. My heart right now is thinking of those children during that time who I got to hear about, that they graduated, that they had a chance to go off to college, and they got a chance to experience all of these really special moments despite us going home during the pandemic or after the pandemic. So I would like to say that that's a success story.
I love that. Ladies and gentlemen, we're talking to Carla Newman, who is the Senior Director of Public Affairs at Legacy Community Health, and Antoinette Wilson, who is the Director of School-Based Therapy at Legacy Community Health. They're sharing with us about their Legacy School-Based Health Program, the mission and the purpose behind Legacy Community Health. What is it about the clinics that you want parents to know more about in this program? What would you like them to know today that maybe they are unfamiliar that you all are doing there?
I think parents need to know that if their child attends a KIPP school district, a Galena Park school district, or a Yes Prep school district, these services are available, they are convenient, and they're right there at those school sites. I think parents should know that they do not need to leave work to take their child to a doctor's appointment, to a therapy appointment, or to a psychiatry appointment, that their child can receive those services during their school day. That includes immunizations, vaccinations, sports, physicals, all of those things that we do as a parent, and we take our child out of school to go do. That is accessible right there at their school site. And I think that's so, so important that they need to know that.
Love that. And ladies, we do have to wrap this interview up, and we'd like to leave fans, followers, listeners, and supporters with something inspiring, something empowering, something they can take with them the rest of the day, the rest of the weekend, all the way up to the weekend. Carla Newman, Senior Director of Public Affairs at Legacy Health. Please, what would you like to leave us with today?
Well, as a child of a single mother, I know my mother could have, this would have been a godsend to her to have these services available to me back then. And so I just think it's a tremendous service to the children of Houston, those which we can currently serve and hopefully will serve even more in the future. We started out with just a few clinics, and now we're over, the majority of our clinics are school-based. So it is my hope and desire to be able to offer these services to many, many more thousands of Houston's children.
Thank you, Carla. And how do we find you?
www.legacycommunityhealth.org, or our phone number is 832-548-5000. Again, we have standalone clinics, so we accept families, whether or not, and children, pregnant mothers, geriatric care, just about dental, vision, any kind of care your family needs. We can see you in our regular clinics, as well as if your child's in a school-based clinic. So please give us a call, go to our website, make an appointment, and we'll make preventive health care accessible for you and your family.
Thank you, Carla. Antoinette Wilson, leave us with Director of School-Based Therapy. Leave us with something inspiring, something empowering, something we can take with us the rest of the day, the rest of the weekend, all the way up to the weekend.
I think that is so, so very important that as a mom, as a employee, that we take moments to care for ourselves so that we can care for others. Mm-hmm. We have to make sure that we are filling our own cup before we fill the cup of others. And I just want to remind parents and remind everyone who's listening in this moment to make sure you're taking care of yourself. And a great way to do that is through therapy. Give yourself the opportunity to talk about how you feel. Allow yourself to release certain emotions that we're holding on the inside. And I'm just so honored to be here today and to be able to share about what I love with you. And I thank you.
Thank you both for being here today. We really appreciate your time and all that you're doing to impact community in a real way, in a positive way. Please, one more time, tell us how we can get to Legacy Community Health. Either one of you.
The number to support and sign up for our school-based health services is 281-628-2050. And if you are interested in making an appointment at the Legacy Standalone Clinics, the number is 832-548-5000. We look forward to working and serving, and we appreciate it.
And we're also opening 2 new clinics next year in Acres Homes. We're very proud to be joining that community and to become a part of that community, as well as Pasadena. So we're growing all the time, so please come and become one of our patients.
We'll have to bring you guys back when you open those 2 clinics, or please invite us to come and to your ribbon cutting or what have you. Hey guys, look, I'm Amanda Sapp. This has been another segment of Mission Possible. You had a chance to hear great information regarding Legacy Community Health and their Legacy's school-based health program. For more information, please follow their movement, or you can call 281-628-2050 for more information. Until next time.